50% of heart attacks are preventable. 40% of cancers are preventable. 40% of dementia are preventable, and 58% of diabetes can be prevented with lifestyle intervention. I often see myself telling the patients, I wish we had met 10 years earlier. In people who eventually developed diabetes, out of these 6,500 people, the metabolic changes were already detectable 13 years before the diagnosis. The system is, when they get diagnosed, there's already a lag time, and then by the time they come to a specialist, there's more lag time. Silent decade is a scientifically validated. It's a concept of metabolic changes. They begin at least 10 to 20 years before the diagnosis. I am describing 10 to 20 or 10 to 15 years of metabolic deterioration that precedes every major chronic disease diagnosis. It's the years when the intervention would work best, and it's the years when almost no one is watching.
Welcome back to Lower the Dose Season 1, Diabetes and Metabolic Wellness. Today's episode is a little different. We're talking about something deeply personal to Dr. Rangi, her upcoming book, The Silent Decade. Because what she's seen over decades of practice is this. The damage doesn't begin at diagnosis. It actually begins years earlier, oftentimes quietly and silently. So let's dive into this super important episode. Hi, Dr. Rangi. How are you doing today?
I'm doing well, Leila. Good to see you again.
Good to see you too. I'm excited to have an episode about your upcoming book. I know we talked a little bit about this previously, so I think it's important for all of our listeners to be able to learn about your book that's coming out. And what really made you want to start this book and feel compelled to write this book, The Silent Decade? Can you tell us a little bit about what The Silent Decade actually is?
Yes, Leila. First of all, in my 20 plus years of practice, what I have noticed is I often see myself telling the patients, I wish we had met 10 years earlier. Not once, not twice, but multiple times. So it's sort of something that repeatedly kept coming to my mind, that why am I seeing patients or people, clients so late, right? We should be meeting earlier. And what I noticed was it was a system problem. It is a system that is making them wait to see me 10 years later. And what is that system we're talking about? The system is, when they get diagnosed, there's already a lag time. And then by the time they come to a specialist, there's more lag time. So technically, I should have met them 20 years prior. So what is silent decade? Silent decade is a scientifically validated. It's a concept of metabolic changes. They begin at least 10 to 20 years before the diagnosis. Okay. So it's not a metaphor. It's a clinical reality that is backed by decades of research. There was a landmark study where they followed about 6,500 people for 13 years. And what they found was something remarkable. In people who eventually developed diabetes, out of these 6,500 people, the metabolic changes were already detectable 13 years before the diagnosis. So the insulin sensitivity was already reduced, the glucose had already started creeping up, and the body was already struggling. More than a decade before anyone called it diabetes. So diabetes is a diagnosis you can make based on certain numbers and diagnostic criteria. But what we're talking about is what has been going on in the previous few years. Could we have done something sooner? Could we have caught it sooner? And at that point, maybe it was reversible. And by the time we catch them, some of the damage becomes irreversible. And patients end up paying the price because they didn't know any better. They go to the doctor and they do the blood test, and the annual physical doesn't diagnose it. All we tell them is your tests look normal, right? And there's a subtle changes that are happening over time, but they're not evident on routine exams for an average doctor's visit. I tend to catch that more because I do more advanced tests to find things earlier because of my interest in metabolic health and longevity. However, The standard of care that we have, our traditional medical practice, where we do annual physical once a year and a routine blood work, can totally miss prediabetes, diabetes in the earlier stages. And those subtle changes had started about 13 years prior, like I mentioned. There's another study that was done. It's a Swedish study where they looked at 300,000 people, and they found that the elevation in the glucose, triglycerides, and the body mass index were present more than 20 years before the diabetes diagnosis. So not only is a decade, it's 13 to 20 years before you can see subtle changes in the body. That's not something small. That's a generation of silent decade. There's a pattern that holds for heart disease as well. There was another study they looked at there's a Dutch study where they looked at tracking people for 15 to 20 years. And what they noticed were that those who eventually had the heart attack or the stroke had unfavorable metabolic markers for 15 to 20 years before their event. So I often see, even in my family or my friends or my colleagues or our patients, who'll say so-and-so had a sudden heart attack. The whispers are there. We need to listen. There's a message coming, but we need to decode it. Their systolic blood pressure was climbing slowly. Their waist circumference is expanding. Their kidney function may be declining. All this was happening silently in this study that I'm talking about, the Dutch study, where patients had no symptoms. It was silent, invisible, while their annual physicals were completely normal. So when I say silent decade, I am describing 10 to 20 or 10 to 15 years of metabolic deterioration that precedes every major chronic disease diagnosis. It's the years when the intervention would work best. And it's the years when almost no one is watching. We're not looking for it.
Wow, absolutely. And that's all wonderful information, especially from your experience in all these years that you've been practicing. What would you say that the silent decade means clinically?
Yeah. So, what are the most, clinically, it is the 10 to 15 years that we talked about, right? Of the silent deterioration in the health or the metabolic deterioration that happens. But the most common patterns that you see during this hidden phase or the silent decade, um, there's a predictable cascade that I see again and again in my practice. And the research confirms it. Number one, the insulin rises. This is the earliest signal. Your pancreas start working harder to keep the blood sugar normal. On paper, your glucose looks fine, but behind the scenes, your body's compensating. There was a study that showed that the insulin sensitivity was already reduced 13 years before diabetes diagnosis, as I mentioned earlier, with a steeper fall in the last 5 years. So even though there could be subtle signals 13 years prior, but you see a lot more obvious signs in the previous 5 years. So after insulin resistance, the second thing is inflammation builds up. As insulin resistance develops, the inflammatory markers start to rise. One of the most common ones that we look for is highly sensitive C-reactive protein, which we measure in advanced panels like ours, and that begins to climb. This low-grade inflammation is what connects metabolic dysfunction to heart disease, cancer, and dementia. And we'll come back to that in a few. So first was insulin rises. Number two, inflammation builds up. And number three, your body composition shifts. With increase in insulin, your body puts more glucose in the fat cells. The visceral fat goes up. That's a dangerous fat around the organs that accumulates. Waist circumference expands, our muscle mass declines, and this happens gradually, often without any dramatic weight changes on the scale. The fourth change that happens is your blood pressure can start creeping up slowly, even up to 18 years before a heart disease event can happen. Fifth change that we see is the pancreas start to fail. After years of overwork beta cells, the cells that make insulin, they give up. they've been overworking because of insulin resistance. The cells that make insulin, they begin to burn out. In the same Whitehall study that we mentioned earlier, that showed that the compensatory increase in the insulin secretion 3 to 4 years before diagnosis, followed by steep decline. By the time the glucose finally crosses the diagnostic threshold or the diagnosis of diabetes, you have lost significant beta cell function. We sometimes say 80% of the beta cell function is gone by the time you notice the high blood sugars. So the tragedy is all these changes are detectable. We don't see them. We don't catch them with the routine annual physical. We have the tools to see them, but the standard annual physicals aren't designed to look for them. They're designed to diagnose disease, not to prevent it. I hope that answers.
Absolutely. And why do you think that people feel fine or they feel okay while metabolic damage is already progressing?
Yeah, this is the cruelest part of the silent decade. Your body is remarkably good at hiding the damage. Our body is always healing. It's got this innate nature to heal and not to show the damage. So the body compensates. For years, our pancreas works overtime to keep the blood sugar under normal control. The liver adjusts, the kidneys compensate, and you feel fine because the body's fighting to maintain the homeostasis. It's trying to keep everything in balance. But that compensation comes at a cost, and eventually the system breaks down. The research has shown that by the time someone has prediabetes, they have already lost approximately 40% of their pancreatic beta cell volume compared to the people with normal glucose. 40%. And they feel completely normal. The symptoms are subtle and they're easily dismissed. People might feel some fatigue. They may feel a little sleepy after meals. They might find it a little harder to lose weight, a little more brain fog. These aren't dramatic symptoms and they don't send you to emergency room, but they're kind of things you attribute to maybe aging or stress or busy life. And here's something most sobering statistics. Only about 11% of people with prediabetes know that they have prediabetes. In the United States, we have almost 98 million Americans who have prediabetes, and almost 89% of prediabetes patients don't know they have it. So almost 90 million Americans are walking around with no idea they are in the silent decade. I think that's the key why I'm writing the book, because so many people have it and they don't know they are at a verge of getting a serious complication from the metabolic changes that they're having. They feel fine. Their doctor says they're fine, but metabolically, they're already on the path towards diabetes, heart disease, or even worse, maybe dementia or maybe cancer. Now, did you know 50% of heart attack and strokes and 40% of dementia and 40% of cancers are preventable?
Wow.
And they have a common denominator of poor metabolic health. So if your metabolic health is poor, which I am trying to highlight in the silent decade, that is projecting you to one of these complications. You just need to start working with someone who can help you look at those, diagnose them earlier, help you with a plan so you can take care of yourself, so you can prevent those serious complications that we just talked about.
That's a huge, huge amount of people. It's so important you're bringing so much light because I think so many people can relate to that. You feel a little tired after you eat, or you think some changes maybe because of age or any other factor that's going on, and it can be something so much bigger. And so many people, like you said, don't even know. But what was there, or was there even an emotional turning point for you that really made you want to write this book?
I think the emotional turning point was loss in our family. My brother-in-law, my sister's husband, he was absolutely fine. And 50th birthday, and he's dancing at his niece's wedding, and he dropped dead. Nobody knew he has a heart problem. Even his family didn't know. He didn't know. Everybody thought he's healthy, right? Because he was getting physicals and everything was turning out to be fine. That was shocking. That shook our family, you know. After that, we had few more family members who ended up getting either open heart bypass or angioplasty. And these are um, extended family members who are in their 50s. And I often see them acknowledge the fact that, oh, well, my mom had it or my dad had it. So, I'm doomed, or, it's a genetic or family history, so I couldn't avoid it. Um, but what we have seen over time is genetics loads the gun and lifestyle pulls the trigger. So the mom might have had heart attack or stroke at age 75, but the kids are getting it in their 50s, 20 years earlier. So that's clearly something to do with their lifestyle. We're seeing so much more change in the environment, the way people are eating, the way our food is modified. There's so much of genetically modified food we're eating. Our wheat is altered. Our grains are altered, no matter how much clean eating you're doing, you have more risk of getting exposure compared to someone else in the past, like our parents or grandparents, because overall their choices were a lot more cleaner. So because we cannot change everything, we can change our choices, we can change our activity. But at the end of the day, you're living in this world that has so many toxins and changes that have already happened that you have to learn to also keep up with the early changes that you can catch and take care of them sooner than later. So I really think the emotional turning point was my family. And he would have been alive had we known anything about his heart, and if he had been a little more aggressive and tested the advanced metabolic mapping that I call, where you do a little more advanced tests to find out um, things that we normally don't check in our annual physical, and insurance might not pay for it, but we got to go above and beyond to take care of ourselves and work with the best and learn what does it take to find out things that can change the trajectory of our life, right?
Yeah, I'm so sorry for your loss too. I think that that must have been, absolutely tragic, especially in the situation and event that was going on. I think that what you said is so crucial about taking the step further to do other tests that may not be included in your annual workup and your, annual physical. And I've known people that seem completely fine as well, and then also just drop dead or pass away in their sleep young. I know that someone that happened to my friend's fiance and was, I don't know, early 30s at the time. And I know someone who was in their early 20s and had a heart attack out of nowhere and had no prior knowledge of having any issues. So it is so important about the silent decade, because we can all be experiencing the same things and not know that there's something wrong. And when people do read The Silent Decade, what do you want readers to feel when they finish the book?
That's a great question. I I want to make sure, and I'm so glad you asked me that question, because I don't want them to. I'm not here to create fear, and I'm not here to make them feel scared. Okay, so number one, I want them to feel informed. Fear paralyzes and knowledge empowers. So I really want them to feel empowered with the knowledge, right? I want the readers to understand what's actually happening in their bodies during the silent decade, not in a medical jargon, but in a plain, simple language that they can use, right? So number one is feel informed. Number two, I want them to feel hopeful, because the research is clear. Like I told you earlier, 50% of heart attacks are preventable. 40% of cancers are preventable. 40% of dementia are preventable, and 58% of diabetes can be prevented with lifestyle intervention. I think that is huge. So I just want them to know that it's not to scare them. They just need to know where they are, and they need to feel hopeful, even if they have subtle signs or anything on the testing, then there's hope here that so much we can change. Silent decade is not the destiny, it's a warning. When we look at those warnings, it can save lives. And the third one I want them to feel is I want them to feel activated, not overwhelmed, but activated and excited to understand the action plan, what they should have. But clear on one thing that they can do next. After they read the book, they need to understand what step they are going to take. And whether that's getting comprehensive metabolic testing or starting a walking routine or simply having a different conversation with their doctor. I think that's something very important that I want them to understand. What is that one thing they want to take from that book? I want them to close the book and take the action. The worst outcome would be if someone read the book, feel scared, and do nothing, right? The best outcome is for someone to read it, understand where they are, and change their trajectory. That's what I'm hoping for.
Absolutely. And I like that you said it is a warning. It's not a destiny. So if people are realizing that maybe they're in their silent decade, what would you recommend that they do next?
Yeah, I think the evidence is very clear on this. Number one, that they need to do is step one is get a comprehensive metabolic testing that goes above and beyond the standard physical, which we call annual physical. I call that annual physical 2.0. So they need to set up an appointment with their doctor. And if they're not comfortable, then find out who they can work with and get that annual physical 2.0 appointment to get extensive testing or more comprehensive testing with advanced metabolic biomarkers or tests. The standard labs look at glucose and maybe an A1C. But as we discussed earlier, insulin resistance develops years before the glucose crosses the diagnostic threshold. So you might find completely normal glucose, you might find completely normal A1C, but you want to catch it even sooner, what changes are there and if they can change and what they can change. So you need to measure fasting insulin. You need to look at inflammatory markers like highly sensitive CRP. You need advanced lipid testing that looks at particle size and number, not just the total cholesterol. You want to look at LP little a, you want to look at ApoB, you want to look at tests for cholesterol that tell us more than just a routine cholesterol testing that tells us if it's something running in your family or what is the best approach for treatment here. So that's number one. You want to get your annual physical 2.0, get your advanced metabolic testing. Second is you need to know your numbers and know what they mean. Okay. Don't just accept normal, but to ask, where am I on the optimal range? What's my trend over time? It's possible that your fasting glucose used to be 80 and now it's 88, or maybe now it's 99. You're so close to getting on the other side. So that is a perfect time to catch. Am I getting better or worse? The third question is address the 4 foundations. The research is overwhelming. Lifestyle intervention reduces diabetes by 58%. Nearly twice as effective as medication. They looked at metformin and pioglitazone and lifestyle did the best compared to the medications. So lifestyle is so powerful that it can work twice as effective as medication. So that's food, movement, sleep, and stress. Those are the 4 things that you need to work on. These aren't optional or add-ons. They're foundation of metabolic health. Okay. So number 1 was we're looking at annual physical 2.0. Number 2, you need to know your numbers and the trend. Number 3, address the 4 foundations. You don't need to go anywhere for that. You can work on that by yourself. But the studies have clearly shown if you find somebody who can motivate you, if you have accountability, your success is much better. For example, we offer lifestyle program in our practice, and that you get a health coach who works with you. We give you a structured program and a structured, plan. But not everybody needs that. But if you feel you've tried this many times and it didn't work for you, then look for some structured program that can work for you. And the last or the 4th thing that I want people to know is find a clinician who practices prevention, not just disease management. Someone who will look at your trends over time, someone who will intervene during your silent decade, not after it's too late. And if you want roadmap for all this, that's exactly what the book is going to provide you. It's a guide I wish my brother had, or my brother-in-law had, or his family had.
Absolutely. Prevention is so important and it could really save so many people and the trajectory of their life, like you said. How does this book tie into your Precision 30 and your lifestyle programs?
Leila, the book is the why. Why do we need to take care of ourselves? For example, when every time I see a patient now, since I started working on this book, I look at the person and I say, could this person be in silent decade? And in fact, I do the same thing in the mall. I do the same thing when I'm in a public, thinking to myself, could this person be in silent decade? And I cannot tell you how many times I feel very strongly about it, that I need to tell this person to get more advanced testing. But of course, you cannot say it in public. But of course, for my patients, I can. So your question is, how does this book tie into our special testing, which we call as Precision 30, which is my advanced metabolic markers that we test, or metabolic mapping, and the lifestyle program. So that really helps people get the answers that they need. In the book, I explain what the silent decade is, why it happens, and why it matters. And I give readers the framework, what I call the health equation. The health equation is map where you are. Number 2, transform your trajectory. And number 3, protect your gains. Okay. But reading about prevention, actually doing it are two different things, right? That's where our program comes in. So Precision 30 is a map phase. It's a comprehensive metabolic testing that reveals where you actually stand, and not just whether you have the disease or not, but whether you are truly in silent decade. We measure what standard labs miss. We check the fasting insulin, we check the inflammatory markers, we check the advanced lipids, we check the body composition and more, right? We look for the calcium score. We look for advanced biometrics, continuous glucose monitor, things like that can help us catch the early changes in our body. Then our lifestyle program is for the transformation. Once we know what's your metabolic picture looks like from our testing, then we implement that and create a lifestyle program that is based specifically for you, for your needs, and for your risks and for your goals, right? So that's your transformation phase. And again, like I mentioned earlier, the research shows that lifestyle intervention is most powerful tool we have. Reduces diabetes by 58% and benefits last as long as 20 years after intervention ends. So you're not wasting anything by working more on your lifestyle. But most people don't know how to do it effectively. So that's why we have a 120-day program, the transformation program, that provides the structure, the coaching, the accountability to make these changes last. And our ongoing care is protection. Okay, so mapping was the first, next was transformation, and third is protect, because the metabolic health isn't one-time fix. It's a lifelong practice, right? We track your progress over time and adjust your plans as needed and catch any backsliding before it becomes a problem. The book gives you the knowledge, the program gives you the implementation, and together they give you a real chance to escape the silent decade. One more thing I want to add here is the Ozempic craze, or the Mounjaro craze. So many people are losing weight with that and they think they're fixing their metabolic health. It's just part of the equation. It's not addressing your inflammation. It's not addressing your risks. You're losing so much muscle mass, So don't try to cut short. You need to understand what your risk is before you start taking these medications. And we need to have a goal, what we're trying to achieve. So just taking these medications is only half the equation, or part of the equation. You need to know more than that. You could still be in silent decade and you could still be at risk for having complications if you don't address the other part of it.
Absolutely. And you touched on this a little bit earlier about you want people to read the silent decade, and then if they think they're in their silent decade, actually take action towards it and not just read about it. But What's the difference between reading about prevention and actually acting on it?
Yeah, so this is a gap that kills people, right? Knowledge alone does not change behavior. Known for decades that lifestyle intervention prevents diabetes. The diabetes prevention program was proved in 2002. That's almost 25 years ago. We learned that you can reduce diabetes with lifestyle changes in 58% of people over 20 years ago. And yet, at this time, 93% of Americans are still metabolically unhealthy. So we do have plenty of knowledge. We're not implementing it, right? Why? Because knowing what to do and actually doing it are completely two different challenges. Reading about prevention is passive. Acting on it requires structure, support, and accountability. So most people don't know how to implement that. And that's why we offer the lifestyle program that people can work on. But even otherwise, in the book as well, I've explained that pretty extensively. So not that everybody has to come see us. They can do things on their own as well, or they can work with their doctors. Research on behavior change is clear. Intensive lifestyle interventions work because they provide more than 16 sessions of structured support, regular check-ins, and ongoing accountability. Okay. So if you're doing it on your own, you're not getting that structured support. You don't have regular check-ins and accountability. Maybe you can find a partner or a friend who can help you do that. But this is what we called as structured intensive lifestyle intervention. The diabetes prevention program didn't just tell people to eat better and exercise more. It provided a 16-session curriculum, individual coaching, and maintenance support. And that's the kind of structure that we offer in our program as well. That's why I wrote the book and created the programs, because the book gives you the understanding of why that motivates the change. But for most people, understanding isn't enough. They need a roadmap. They need coaching. They need someone watching their progress and adjusting their plan. Somebody who can do periodic testing and tell them how they're doing and what's a better step next. So the book is the spark, and the program that we offer is the fire, if that helps you understand.
Absolutely. And who would you say that this book is especially written for?
It's funny that you asked that. I tell my friends that Peter Attia speaks to 7% of people who are metabolically healthy, who are looking at adding longevity, right? These are high wealth individuals who are trying to live longer, who are trying to work with the best and everything else. What I'm trying to talk to is 93% of US population. 93% of Americans are metabolically unhealthy. So I can't tell you one person. This is not a typo. This is not wrong. That means if you are listening to this podcast, there's a 93% chance that you have at least one marker of metabolic dysfunction. That could be elevated blood sugar, could be abnormal lipids or cholesterol. You could have high blood pressure or excess abdominal fat or belly fat. Most of these people don't know it. Their doctors haven't told them. Their annual physicals haven't caught it. So when you ask me who's this book especially written for, I think it's written for the person who's been told their numbers are normal but doesn't feel normal. You're tired, you're gaining weight, something feels off, but every test comes back fine. This book will show you what those tests are missing. The second person it's written for is a person with a family history of heart disease, diabetes, or dementia. You have watched your parents, grandparents suffer. You're terrified of the same fate. This book will show you what genetics is, that genetics is not destiny, and you can have the roadmap to create your own trajectory. Now, this book is also written for a person who's been told that you have borderline blood sugar being high or you're pre-diabetic, and watch your diet and, move more. but there's no structured plan given to them, and they don't understand that even having prediabetes increases your risk of heart attack and other complications. This book will show you exactly what to do with that warning. If you have prediabetes or slightly high blood sugars or the trend up, then this book is also written for the person who wants to be proactive, not reactive. You don't want to wait until you're sick. You want to prevent disease before it starts. And this book will show you how. And honestly, it's also for healthcare providers who are frustrated with the system that waits until people are sick. I want to give them a framework and a language to have a different conversation with their patients. This book is for anyone who refuses to accept that disease is inevitable. Because it's not. The silent decade is escapable, but only if you know it exists.
Absolutely. I think that this was eye-opening to so many people. I'm sure a lot of people are listening, myself included, and thinking, is this me? Could this affect me? My blood work seems fine, everything seemed fine, but I'm having some of the symptoms you mentioned. So I think it's great that you're shedding a light on this and writing the silent decade. And if today's episode resonated with anyone and you really want to understand what might be happening beneath the surface of your health, you can definitely learn more about this with Dr. Rangi's upcoming book, The Silent Decade, or on her website. And I think what we really learned today is just because prevention doesn't begin because prevention doesn't begin with a prescription. It begins with awareness. And I think that this brought so much awareness to so many people. So thank you so much, Dr. Rangi. And this is Lower the Dose. And I'm looking forward to our next episode and speaking with you again. And I'm really excited to read The Silent Decade when it comes out.